I'm Tatiana. I'm going to be your student physical therapist today. How are you?
Doing good. How about yourself?
I'm doing well, thank you. All right, so I see that we have this wound here by your ankle. Do you mind telling me a little bit about it?
So this started about a month ago, and I guess you could say my doctor's been telling me I have high blood pressure.
Okay.
I think he says the word hypertensive. I don't know what that means. What else? It just kind of started materializing. I don't know why or anything.
Okay.
That's about it.
Okay, so hypertensive just means that you have high blood pressure.
Okay.
So when we take measurements for blood pressure, there's two numbers that read as the measurement, and so you want to make sure that your numbers are between a certain range. So when he says that you have high blood pressure or hypertension, that just means that your numbers are above the normal range that we would like patients. Yeah, so that we would like people to be under. So I do see in your chart here that he said that your last reading was this morning by your nurse, and she said that it was in your chart 158/96. So that is pretty high. Usually we don't like you to be over the first number. That top number would be over 120 or 130. But since you're well above that, and then your bottom number is above 80, so that is something to be cautioned about. What are your eating habits like?
I'm actually a big fan of meat. I eat a lot of meat. Probably like every day of the week, at least 5 days a week, I'm eating like steak or like some real heavy fat meals.
And fatty meals. Okay, any fried foods, high salt, sodium intake as well?
Yeah, like onion rings are my favorite meal.
Okay, all right. And what about water? Do you drink enough water every day?
I probably drink more than I drink water.
Okay, so you drink alcohol. Okay, what about smoking? Do you smoke?
Yeah, I've been smoking for like 15 years.
Okay, and how many packs a day do you smoke?
Not packs per day. Probably like 10 cigarettes a day.
Okay, so is that almost a pack? Is that half a pack?
Yeah,
is that half a pack? Okay, you've been doing it for 15 years. Okay, so what about your pain level? Is there?
Oh, it hurts. It's really bad.
Yeah. Constant pain. Is there anything that increases your pain?
When I'm not, like right now, it's like throbbing.
Right now it's throbbing. Okay, on a 0 to 10 pain scale, 0 being no pain, 10 being the worst pain imaginable. How would you rate your pain?
It's like, it's about an 8 at the moment.
It's about an 8. Okay. Is there anything that relieves your pain or helps decrease the pain?
I try and get up on it to maybe help move it around, but really it kind of stays the same level.
Okay, and so even when you try to decrease it, does it stay at an 8 or does it?
It might come down like to like a 4 or 3 or 5.
Okay.
It's 8's when it's at its like worst.
It's at its worst, and you say that it's at an 8 most of the time.
Yeah, well, it hurts a lot when I'm resting.
Okay.
When I'm just kind of sitting here, relaxing, it's hurting.
Okay. If you don't mind, I'm going to go ahead and just kind of start examining the wound and kind of just telling you a little bit about it. So here I can kind of see that it has a pale wound base. These darker areas that you have here, I can see that it's got eschar, which is like a scab, gangrenous area. So this just means that there's dead tissue in the area. Okay, so that we do really need to pay attention to that. Because it is pale, this kind of signifies to me that you're not getting enough blood flow to the area. So, which would tell me, because of your hypertension and your smoking and your eating habits, that you have some type of insufficiency from your arteries with your blood flow coming down to this area. Okay. I can also tell too that just by the color of your toenails are just they're pretty dark and yellow. Okay. So also because of that, and you don't happen to shave your hair on your foot or on your toes, right? Okay. So because I'm not really seeing any of the hair and there's some hair loss in this area, also telling me that there's not enough blood flow coming down to the area. So, the lower part of your leg is not getting the amount of nutrients or the type of nutrients that it needs to, so that there's healthy blood flow going into the area. And so because it is pale, there's no granulation. The granulation tissue is very poor, since I'm not seeing any redness, because we actually do want to see some red so that we know that there is good amount of blood flow coming. So since I'm not seeing that, it's very poor in this area. So that's what I can kind of examine just by looking at it here. One of the other things I'm going to do is I'm going to take measurements of around your foot and up here in this area, just to determine if there's any type of swelling. Starting now with like a baseline to see where you're at, and if throughout our time with treatment, if it's going to be getting any worse or it just kind of just stays the same. Okay? Is it okay if I do that?
Yeah.
Okay. All right. So I'm going to come around the midfoot here. Does this hurt you if I touch you in this area?
No, this is fine.
Okay. Okay. That measurement I have is 23.5 centimeters. And I'm going to come around your ankle. I know this is going to kind of hurt a little bit, so I'm going to try my best not to cause you any more pain. Okay. Around the malleoli, I have 22.6 centimeters. Okay. And then I'm going to come way over here at the top. So from the tibial tubercle, I'm going to come down 10 centimeters. Go ahead and measure this. Does this hurt right here?
Nope.
Okay. All right, and I have 35 centimeters around your calf. Okay, so just for documentation purposes, if anyone else happens to work with you after me, they can see where we started with measurements on that. Okay. Also, now that I have the tape measure out, I'm going to go ahead and I'm just going to measure the length of the wound and the width, just to also see throughout our treatment, we want the numbers to decrease, obviously, because we want the wound and the ulcer to get smaller. Okay. Has it always been this size? Has it gotten bigger?
It has gotten bigger.
Okay.
Like past week by week, it just seems to keep getting bigger.
Okay. And how long have you had this?
About a month.
About a month?
Yeah.
Okay. Okay. All right. So I'm going to be using the clock method here. So I'm going to start at the 12 o'clock because it's more proximal, and then going down to 6. All right, and I have 8 centimeters from the 12 to 6 o'clock, and then that'll be the length of the wound. And then I'm going to go from the width, which is from 9 to 3 o'clock, and I have 4.3 centimeters for the width. So I would multiply those together to get that actual measurement. Okay, and then from here, I'm going to do another type of exam on your foot. Okay, this is to test your sensation of your foot. Just to see nerves-wise what's going on down here. Okay. I'm going to use this very, very light touch. I don't know if you want to feel it. It's very light touch sensation. Okay. I'm going to kind of poke around the bottom of your foot. Okay. I want you to tell me whether you can feel it. Okay.
Okay.
I'm just going to do some random places here. Okay. So you let me know when you feel it.
Yes.
You feel that there? Okay.
Yes.
Are those strong sensations or very little?
That last one. Don't feel that. Yeah, I can feel pretty good.
Okay.
Yes. Yes.
You don't feel any of those on your toes?
No, those past last 2 I didn't.
Okay. Okay. So just on your toes, so you do have some areas by the top of your foot that you cannot feel. So I would document that and just say that your foot is at a little bit of a high risk here for sensation loss. Okay. So hopefully throughout our time as well, that we'll regain some of those sensations back. Okay. The next thing I want to do, I think we're almost done here. The next thing I want to do is I want to take your pulses here on your foot, okay? Just so I can also see how blood flow is coming to this area, just another type of indication, okay? I'm going to come over here in this area. Let me know if I am hurting you, if I touch you here. Am I hurting you here? Okay. All right. So the posterior tib artery pulse, I'm not feeling. And I'm going to go over here to the dorsalis pedis pulse. And this one I am not feeling either. So obviously, because I can't feel these 2 pulses on you, this also is another indicator that we're not getting sufficient blood flow to the area. Okay. And then the last thing I want to do is I kind of want to measure your range. I know that you said that any activity you do or anything you do with your foot, it does cause you a severe amount of pain. So even when you kind of flex your foot and point your foot, you can't do that very much.
No.
So that causes you pain?
It seems like if I have to actively move it, it doesn't want to do a whole lot.
Okay. And what about if I touch the top of your foot right here? Does that hurt?
Yeah, a little bit.
Yeah, a little bit? Okay. And what about here at the bottom of the foot?
Yeah.
Okay. All right. So for the range of motion, since he can't move it without any pain, he's lost a lot of your range of motion because of this and because of the pain. And just applying a small amount of pressure to measure your strength of your foot, I would give him a 0 out of 5, just because so you can't even move your foot up and down. And so even if I apply a little bit of pressure, and you can't do it against my hand, that just tells me that you've got some weakness here in your foot. Okay, mm-hmm. So because of your ulcer, you've lost strength in your foot, and also the range of motion. So hopefully once we get this healed, we'll be able to work on regaining your strength and your motion back.
Sure.
Okay,
mm-hmm.
So we will hopefully get this taken care of, and we'll see where this goes. Okay.
All right.
All right. Thank you.